The basic foundation of starting this hospital and this institute is to giving maximum back to the society, and also reorganizing our priorities about the society. Generally, we look at the priorities in life, in everybody's life is first me and myself, then my neighborhood, my nearby relatives and all. And later on, then if time and energy is spared, then let us think about the society or the larger part of the country. We have just reversed the priority or the order, and we decided that we'll first think about the society, and while thinking about society and taking care of society, our livelihood and our life will be taken care definitely. So that was the driving force basically. And second thing was to do something for the society. We have to come together, and then there are very less number of charismatic leadership in any countries available. So in social field, that is furthermore less available. So what we decided that if few common people come together, if few simple people come together, something extraordinary can be done. So in organization or in forming team together, generally 1 + 1 is not 2. 1 + 1 could be 11, 1 + 1 could be anything. So we decided that let's come together and do something for the society. And in that process now, to serve the society in better manner and in larger manner, we keep on expanding in vertical direction as well as in horizontal direction. So that's the basis of this. We saw a lot of people who dedicated their life to the society instead of living their own life. So such idols have a very special place in our mind and heart. I distinctly remember during our childhood day and during our medical college days in hostels, we used to be very idealistic students, and most of we are like that during our education. But that thought of that idealistic attitude got channelized when we came across with certain social workers in the society. And the question which brought us to the ground and encouraged us to think about is that most of us, we keep on thinking about and discussing and arguing about the issues of the society and don't do anything about the society. One of the social workers who was present in the meeting at that time, he asked, are you going to be similar to other Indians, argue, discussing and then go on your own path? Or are you going to do anything about this? That brought us together, and then it started. And when it started, we decided that if we are working for the society, then we will expect minimum from the society. And that expecting minimum is still continued. In spite of being a very big hospital, doctors are happy on subsistent and meager salary, in spite of being specialist doctors. And what drives us to do this is we have understood that what you need at all to live a life, a happy life. You need a satisfaction, you need that you are worth something, you need a sense of accomplishment, sense of creating something. So all these we are getting, plus we are getting enough money to live a middle class life, which I think is sufficient. Basically, the purpose of coming together and starting a hospital itself is to start a hospital which will bring a social transformation on this community. So we wanted to start a hospital because we were doctors. If we would have been engineers, we would have started something else for the social transformation. So the basic objective of this organization is bringing social transformation through health services. So the hospital itself has brought some social transformation in the medical fraternity. This hospital is known for honesty and ethicalness. Hospital is known for quality service at affordable cost. Hospital is known for bringing a different work culture in the hospital. Just to give an example of social transformation in the working staff, I am proud to say that in hospital, staff will never accept any tip or bakshisi given to the staff. They will politely refuse that we are very well paid and in our hospital we don't accept bakshisi or tip. Similar way, the hospital started slum centers and rural centers and mobile clinics, and the purpose of starting this was not just to give a free or concessional primary health care to poor people and reach out to them. But the doctor, working as a doctor there, he started different social developmental activities. Because see, when doctor serves community honestly and in a selfless manner, those poor people have developed tremendous faith in their doctor. And when there is a faith, generally, unfortunately, as you've seen, in today's medical fraternity, the faith and the confidence in the doctor is used to squeeze out the patient. We have used the same faith for their own social transformation. When a doctor appeals to a lady that send your son or a girl to the evening tuition classes I have organized, she sends them faithfully. If a doctor's wife asks the lady patient, that why don't you save some 50 rupees or 100 rupees for your rainy days? You give it to me and I will keep it in safe. Initially it started like this, but now there are 302 small saving groups of women. 5,000 women are weekly or monthly saving some or other money in their bank accounts. Their annual turnover is more than 50 lakh rupees. 450 women have started their own businesses. Their income has gone 3 times, 4 times. This has happened only because the doctor has developed a faith in them. Another aspect could be that the health center in the community, which we have 3 health centers and 3 mobile, they are not just the health center. They are actually the nucleus of social change. Health center is used from 6 o'clock in the morning till 11 o'clock in the night for various activities. Morning you will find there is a nursery. Evening you will find some skill development courses. Afternoon, computer training institutes. In the morning hours there will be dispensary. In the night hours there will be study classes, free tuition classes. So the center is acting as a facilitating agent for the community. So the social transformation through health, we found it is easier than through any other medium.
You have been able to set up some rural health centers also.
Yeah. Rural health centers, we started with the same concept that we'll reach out to the poor rural villagers, and then as per the need of the village, we started helping them in finding out proper seeds, how to nurture and how to do the agriculture. But we were short of expert hands, and then gradually we started appealing people from society that why don't you accompany our rural mobile clinic. For example, a couple of animal husbandry veterinary doctors who got retired from the government services, they started accompanying us, and then they started supporting and helping, guiding and treating various animals in those rural villages. And out of that, a fantastic scheme of training one farmer each from one village came forward. We call it Animal Health Project. And that scheme gave birth to 25 villages took benefit of it. And not only that, in recent outbreak of a disease in 75 different villages, we found it that these half-trained farmers also, they saved animals worth 10 lakh of rupees in each village. Just because they were trained and they were following the instructions of the retired veterinary doctor who was accompanying our medical van. Now there are 50 more villages who have sent their farmers for training. Now we are doing another training program for 50 more villages. So it will expand. And the cost we incurred was for 2 years of training for 25 farmers was just 2.5 lakh. That's all. Our organization, which is running a hospital, a blood bank, a network of slum centers and rural health centers, mobile vans. Private sector has played a fantastic role as in terms of providing resources. First of all, like for example, financial resources for capital expenditure and running such activities. Second support private sector has given us is private sector can bring in a lot of management practices, a lot of I would rather say bring in the proper human resource in success of the project. Methodology can be brought in. Just to give an example, a lady from Mumbai, she is a management consultant. She teaches all executive and directors of ICICI-like organizations. She is a very highly paid management consultant. She came in contact with us and she helped us in creating a beautiful organization development program for our organization. She traveled every month for 3 days in Aurangabad and helped us in developing different management practices which can bring in effectivity and efficiency in the organization. Similarly, now L&T has came forward. Larsen & Toubro has came forward and they are helping us in training and empowering women and children in slums in different skills. I would quote an example. L&T has provided us skilled manpower to train school dropout boys in slums. And those boys now are becoming skilled masons. Before this training, they used to earn 100 rupees a day as their wages. Now they have got respect, they have got self-esteem and 4 times more income per day. 400 to 500 rupees their income. So what private sector can play, private sector can bring in all the culture or the practices plus resources. We are appealing to different organizations in private sector to associate not just by giving money, but putting their staff, putting their expert, their people in managing this project. Like Wipro is every week sending 20 of their staff in Aurangabad to serve in rural area, rural communities and put all their resources there. So in thinking, in brainstorming and designing a project and plus supporting it financially, private sector can play a major role. They just have to give a little priority to this aspect in their business.